How to treat and cure itching. The medical term for itching is pruritus. Infections, bites and stings, infestations, chronic diseases, allergic reactions, sun exposure, and dry skin are among the numerous causes of itching. Anti-itch creams and lotions containing camphor, menthol, phenol, pramoxine, diphenhydramine, or benzocaine can bring relief. Some cases of itching will respond to corticosteroid medications. It is best to avoid scratching when possible to avoid worsening of the condition and disruption of the skin that could lead to bacterial infection. If itching persists, worsens, or is associated with skin lesions, consulting a healthcare professional is advisable. Itch is an irritation in the skin that elicits an urge to scratch. Itches are a problem that everyone experiences and can be localized, limited to one area of the body, or generalized, occurring all over the body or in several different areas. Sometimes, depending upon the underlying cause, itching may be worse at night. In medical terminology, itching is known as pruritus. Generalized itch that occurs all over the body is often more difficult to treat than localized itch. Itches can also occur with or without skin lesions, bumps, blisters, rash, redness, or abnormalities that can be seen on the skin. An itch that is accompanied by a visible skin abnormality should be evaluated by a physician and, in some cases, by a dermatologist since the problem is likely to be a condition that requires specialized medical treatment, for example, eczema, scabies, etc. Symptoms and signs of itching. Depending upon the underlying cause, itching may be associated with other symptoms and signs. Most commonly, these associated findings include skin lesions such as rash, blisters, bumps, or redness of the affected area. Dryness of the skin is a common cause of itch. Itching of skin can lead to tears in the skin, excoriations, from scratching. Less commonly, generalized itching all over the body can be a sign of chronic medical conditions such as liver disease. In these situations, there may be no changes to the appearance of the skin. Infections and infestations of the skin are another cause of itch. Genital itching, which may accompany burning and pain, in men and women can occur as a result of genital infections such as sexually transmitted diseases, STDs. Vaginal itching is sometimes referred to as feminine itching, and sexually transmitted diseases can also cause anal itching. Vaginal yeast infections are another cause of vaginal itching. Other common infectious causes of itch include a fungal infection of the crotch, Tinea cruris, commonly known as jock itch, psoriasis, and ringworm of the body, Tinea corporis. Another type of parasitic infection resulting in itch is the so-called swimmer's itch. Swimmer's itch, also called cercarial dermatitis, is a skin rash caused by an allergic reaction to infection with certain parasites of birds and mammals that are released from infected snails in fresh and salt water. Itch may also result from skin infestation by body lice, including head lice and pubic lice. Scabies is a highly contagious skin condition caused by an infestation by the itch mite Sarcops scabii that is known to cause an intense itch that is particularly severe at night. Cause of itching diagnosed. As with any condition, a careful medical history and physical examination will suggest to your doctor the particular diagnostic tests that may be needed to determine the cause of itching. Some common causes like dry skin or sunburn may be obvious, while causes such as chronic systemic diseases or conditions may require blood or imaging tests to identify. If a skin condition is responsible for the itch, sometimes a scraping or biopsy may be performed to identify the condition. Nevertheless, many common rashes and skin ailments have a characteristic appearance that may suggest the correct diagnosis. Itch treatments. Topical itch treatments, those used on the skin, include cold applications, creams, and lotions. Cold applications, because cold and itch travel along the same nerve fibers, the use of cold can jam the circuits and deaden itch. Methods of applying cold include the following. Cool water, either by running tap water over the affected area or placing a cold clean washcloth on the skin. Cool showers. A cool bath. Products that contain colloidal oatmeal are available over the counter as an itch relief bath. Ice packs, either the commercially available type or ice cubes in a plastic bag. Hot water, in the shower, for instance, feels good temporarily, but it can leave you feeling even itchier later. Therefore, the use of hot water is not recommended. Although hydrocortisone-containing creams and lotions are often promoted as itch reducers, this ingredient only helps an itch that is caused by a rash responsive to cortisone, such as eczema and seborrhea. Since OTC hydrocortisone-containing creams and lotions are weak, they aren't too helpful for itch even in responsive conditions. When pruritus is caused by irritations of other sorts, insect bites, for instance, hydrocortisone doesn't help much at all. If you use hydrocortisone for 10 days and experience no improvement, you should see a physician to help determine the cause of your itch. Traditionally, antihistamines are used to treat itch. Examples include diphenhydramine, hydroxyzine, and chlorpheniramine. These medicines can induce drowsiness in many people and must be used with care before driving a car or operating heavy machinery. Although antihistamines may help the itch, they seem to do so mainly by helping people fall asleep and avoid scratching at night. If falling or staying asleep is not your main problem, you may want to try one of the non-sedating antihistamines. Loratadine and fexofenadine are examples of newer second-generation antihistamines that are available without a prescription. The second-generation antihistamines do not have the sedating effects of the older first-generation antihistamines, but they are not very effective in quelling the itch.